What we got here is failure to communicate, a chronic neglect of military mental health care. This is Psychiatric Casualties, how and why the military ignores the full cost of war.
Hi, welcome to Psychiatric Casualties. This is Mark Russell.
And this is Charles Figley. Hi.
Hey, Charles. A belated Happy Thanksgiving to you.
Yeah, same to you.
Thank you.
I guess the audience is not aware of this, but we're separated by the entire country, in effect.
That's right.
I'm in Florida. You're in Washington State.
We're literally, like you said, separated from one side of the continent to the other, huh? But not separated in mind and spirit.
That's right. Yes, absolutely.
Yeah.
And this chapter is no different. I mean, each time I read over for the first time in a while, we argued over that and all that, which is not that frequent, frankly. I think we much agreed on nearly everything, but just I kept shaking my head like, how can this happen? No. And how it happened was basically the book.
Well, I definitely think the book certainly I think it's the only book, again, the only thing in writing that I'm aware of that even outlines the problems of military mental health care. And then nevertheless try to delve into, attempting to explain these avoidance strategies that the military uses to avoid learning its war trauma lessons. And then the consequence, of course, is these generational self-inflicted wartime behavioral health crises that we just went through, and we'll likely go through another one once we have another major war, unfortunately, unless these lessons are ever, firmly learned and incorporated. But and so what is this, the 9th or 8th?
This is chapter 10.
Yeah,
chapter 10. And it's the 21st and 22nd show that we're taping together.
Yeah, well, it's been a blur. And in this particular, the chapter 10 in our book is about avoiding accountability. And that's the 8th so-called, we call it dark strategy, because it's harmful in that sense, ways, again, how the military avoids its lessons. And when I talk about accountability or the lack thereof, one of the questions we get asked very often is when people learn of all the problems of mental health care military mental health care that we've delved into, the question inevitably comes in, well, why? Why does this happen? What would it explain why the military selectively ignores and neglects these hard-won, war trauma lessons? And one of the reasons you have to come up with in explaining it is this issue about accountability and how the military is organized, the leadership structure and policies that around mental health. We'll delve into these next 2 episodes.
So this is dark side, and there are 10 dark sides.
Yeah, 10 coming overall, right?
Yeah, so we're coming close to the end in this regard, but
yeah,
I wanted to mention again that not for public view, that has frequently been stipulated in, because the military wants to keep it outside of public view. And you had the most interesting perspectives on that, I might add, because in your work and my work, whenever we're working on clinical issues, I mean, it's confidential, et cetera, but Jesus, I mean, there were so many times in which the same errors were made. You would think after a while, we would get that. You got it. I learned from you, but it's going to continue.
Yeah, well, and like you said, it's not in the public. It's certainly not. You have to really want to dig for it and know where to dig to even get the information. But that said, there are public records, there are books published, there are government studies that have been published by every generation since, say, the First World War about these psychiatric lessons learned, what mistakes were made and how to do better in order to meet the mental health needs during wartime. And very robust lessons learned documents up until, until after the Second World War in Korea. And then from that point on, from Vietnam on, it's really, the military seems to be decided it doesn't want to make public its lessons learned, if even they even gather it when it comes to psychiatric lessons. And again, that kind of harkens to this chapter about how the military is organized and leadership and who's in charge of mental health care in the military, and why it's so easy to avoid
Escape
accountability.
responsibility.
Yeah, responsibility. Now, we're both a couple of former Marines. I also spent some time on the blue side with the Navy. And I'm sure this is true with all services, both active, reserve, National Guard. And that is, there's a real impetus, but from basic training or officer school, however you come in the military, about responsibility and accountability. I mean, it's preached at the highest level and reinforced at every level of one's experience in the military. And it certainly was drilled in my head that, the whole thing about the chain of command is a chain of responsibility. And if something goes awry, if there's a problem that exists, the accountability is that those who are ultimately in charge, who have the authority, who either through their fault or not their fault, but something happens, they're going to be relieved of duty, or they're going to be taken to task. They're going to be held accountable.
This has actually been demonstrated numbers of times, particularly in terms of the Navy, in which the captain of the ship, boom, she's gone.
Yeah.
No questions asked. What happened? Very fast in that regard. So that's something, I guess, that they act quickly.
Very quickly. And it's just almost again, it's like a knee-jerk response. But yeah, I've known many and read about and known personally captains of submarines or surface ships, for example, who, they was late at night and they were trying to get some sleep, which they are afforded, even though they are a commanding officer or whatnot. And then something happens during that night watch, right? There's maybe a shipboard fire, or there's a collision of undersea mountain or something. That has been all kinds of things that can go awry, some collision with the ship. And the first thing that usually ends up happening is the COs are relieved of their duty. They're held accountable, even though they did nothing wrong. They followed everything by the book. They had a qualified officer on the watch who, was responsible for safely navigating the ship and, monitoring things. But the one who's held ultimately accountable is those in authority. So whether it's a Navy captain, right, of a ship, it could be an Army commanding officer of a base or a unit. If there's a rash of suicides on a base, if there's a lot of military sexual trauma, there's a lot of bad publicity of something going on by unit members, subordinates, usually the one who gets held accountable, other than those who might, commit some violation of the UCMJ. But as far as the goodwill and welfare and discipline, is the CO is going to be accountable. And so Army generals, Army colonels, captains, etc., of all the branches, that's the way it is. That's the whole chain of command, right? It's all about who's being responsible and being accountable for the people below you and executing the mission. And the military don't mess around with that.
Yeah, I certainly noticed that. I'm wondering, though, where do these folks go? I mean, are they kicked out? I mean, in some circumstances, but how harshly are they treated, even though they were not in charge at the time?
Well, that's a really good question. And it probably varies. Again, if it's due to some of their own misconduct, there's been a rash in the military news of commanders, commanding officers of different branches being relieved of duty for various reasons. And certainly, excuse me, of course, if they did something, if they engage in misconduct, then that's different. They'll either be court-martialed or have something like NJP, some administrative duties, and or are kind of forced to retire, if they're at that level. But for people who are relieved of command, who did nothing wrong other than that they were the one in charge and they're being held accountable, many of them, again, are usually senior officers. And so they will lose their command. They lose any chance of being promoted after that. And so most of them, rather than deal with the humiliation of staying on active duty and then, with a record of being removed as a commanding officer, they end up retiring or leaving the service. Some may hang on for different reasons. The ones I know personally end up retiring earlier than once that promotion or that career became shortened after they were removed.
And more often than not, they have their retirement, but it's not a great way to leave the military.
Yeah, I mean, certainly if you're, looking to get the next rank and become a flag officer, a pin on that next star, and then, because you got this commanding officer billet and now you're removed from it, it's pretty demoralizing to say the least. And then again, people will often be in a position still they can recover, unlike somebody who doesn't have the means or welfare, like resources to, but they'll get out. But it's, accountability is the hallmark of the military. If you screw up, whatever your rank and whatever your status, you're going to be usually held responsible or accountable for it, and that's how the military system works. And
we've seen over and over again, it doesn't work. So
with
why?
mental health, it does.
Yes.
Yeah. Over and over
Why?
again.
Frustrating.
Yeah, it really is. Yeah.
There was go ahead.
Well, let's see. I was just looking at this one quote just to kind of get started. This is from the Institutes of Medicine, which is the medical watchdog for the government that was commissioned to look at PTSD treatment in this case in 2014. Again, 2014 is about 14 years after the start of the wars in Afghanistan and Iraq. And this is what their conclusion was after they did a comprehensive evaluation of the military's programs for PTSD. And then, quote, in DOD, in each service branch, unit commanders and leaders at all levels of the chain of command are not consistently held accountable for implementing policies and programs to manage PTSD effectively, including those aimed at reducing stigma and overcoming barriers to accessing care. In each service branch, there is no overarching authority to establish and enforce policies for the entire spectrum of PTSD management activities. A lack of communication among mental health leaders and clinicians in DOD can lead to the use of redundant, expensive, and perhaps ineffective programs and services, while other programs may be more effective, languish, or disappear, unquote. Well, that was true in 2014. It was true in 1914 and 1945 and 55 and throughout the 70s and 90s and up until present day. That statement, though, I mean, it really resonates with me, is that we're just talking about accountability and how the military holds people accountable for every other reason, every aspect of the military's mission and duties, with the exception of mental health.
It's discouraging.
Yeah.
At the very least.
Well, it begs the question again, like people want to know, well, why is that? How can that happen, right? I'll give you an example. You probably remember in 2006, 2007, there was a big scandal, a national scandal at Walter Reed.
Oh, yes.
Right? The flagship military medicine and the headquarters of Army medicine. And boy, I mean, it was, dilapidated barracks, right? People were with cockroaches and rats, and they were left They were neglected in these barracks. They didn't have proper follow-up. People had committed suicide. People had gotten to basically, gross malpractice on behalf of the Army medicine. And, Congress got involved after this came out in the, I think, Washington Times or Washington Post or something. So the national news media got involved. Congress, of course, gets involved then. All these hearings. And what happens? Well, the civilian leader of the Army, the Secretary of the Army, gets fired, is held accountable. Now, was he at Walter Reed? Did he know all these problems in the barracks and the lack of follow-up and treatment? Not really, no. He's overseeing the entire Army, okay? But that didn't stop at that. There were other people even below him that were held accountable and fired, let go. These people left the Army, including the Army Surgeon General. And the Surgeon Generals are responsible for each service. There's a Surgeon General for the Army, there's one for the Air Force, and there's one for the Navy Marine Corps. And they're responsible overall for overseeing medical care in their service branch, right? Well, the Army Surgeon General was relieved, was booted out of the Army. That particular Surgeon General, by the way, who I met, was the chairperson of the DoD's task force on mental health that was congressionally mandated. So when I testified before that task force, I met with this, I think it was a 2-star or 3-star Army general. And then I think it was around February of 2007, he was let go. He was removed, held accountable. So here's the juxtaposition of that. So there you have this broad scandal of the Army and Army medicine, and how poorly treated these soldiers, Marines, and sailors and airmen were when they're coming back from the wars in Afghanistan and Iraq. And all these people got fired from the highest levels. And that's how the chain of command is supposed to work, right? That's the whole idea of accountability when it comes to the military system. February 2007, the Army Surgeon General gets fired over this scandal. In June of 2007, the DoD task force, which was comprised of the other service generals and a bunch of other leaders, senior leaders in military mental health care, released their report in June of 2007. And in there, they disclosed for the first time, they were transparent and said, we are failing and negligent in every aspect of military mental health care. 99 corrective actions required, and from lack of staffing, from inadequate assessment, lack of access of care, lack of continuity care, lack of treatment, inadequate resources for family members, rampant stigma. I mean, go on and on and on. Every aspect of mental health was found to be deficient, despite years of congressional sworn testimonies to the contrary by these same people. So that task force report gets read out. The national media covers it. Congress, this is a congressionally mandated task force to evaluate mental health. And not a single person gets fired. No one's held accountable. In fact, they were lauded, they were applauded, they were rewarded for being so transparent and so cutting edge and progressive in their view of how they're going to better military mental health care. No congressional hearings were held to investigate, well, why were you telling us these lies as early as May of 2007? And then in June, 1 month later, you tell us just the opposite is happening. They didn't call these people back after their sworn testimony and read them the riot act or fire them or anything. Nothing. The national news media didn't pick it up. The contradictions. They just went with the military's line that this was unheralded. This was a great step, a progressive step, despite the fact that every generation has documented the same war trauma lessons or what's required. And the military had full access to those lessons, but chose to ignore it. No accountability, zero. So when you look at the Walter Reed scandal, that was just in 2006, early 2007, and then you go into June of 2007, the full-blown scandal of the military mental health care, and you see how different people, as far as accountability goes. That for me struck a real chord.
Well, when you read about this back in 2007 or so, it struck a chord, but how did it affect you? I mean, you knew more than anyone else that they were not doing what they should be doing, and the country's vulnerable, especially with regard to military troops and mental health. I mean, how did you respond to that?
Like I'm doing now, I'm shaking my head. It's like I was outraged because one of the things that led to the formation of this congressionally mandated task force on mental health was my DOD IG complaint in 2005, which I detailed most of those 99 corrective actions back in 2005, early 2006. And I sent it to every Surgeon General, to all the secretaries. I'd send it to congressional members. So they all got a copy of this IG complaint, which was, I don't know, 30 some odd pages long, if you would, very detailed, factually based, data driven. And that was why I was called to go testify before the DOD task force back in late 2006. So when I get this report in 2007 that the DOD task force concluded basically the same things that I and others were saying was going on all along, and there's no accountability. And then I said, okay, well, now it's time. I got to do something else. So that's when I became the whistleblower and started, speaking to the media more openly about these struggles. But yeah, I mean, it's infuriating. At that time, I had two sons that were in the military, both of which deployed to Afghanistan. One with the Marines and one was a Navy corpsman with the Marines. And I'm looking at a next generation, my own kids, and then other people's kids and grandkids that are going to be impacted by this. And then you get this statement that I just read from the Institutes of Medicine 2014, and they're saying, again, quote, not consistently held accountable for implementing policies and programs to manage PTSD effectively, the chain of command. So, like, how can that be? Why is that? What is it about the military's chain of command when it comes to mental health that contributes to this gross neglect and the lack of accountability when it comes to mental health care?
It seems because they could get away with it.
Oh, absolutely, they get away with it.
So that's being passed down as we speak, probably, to those that are replacing.
Yeah.
Ah.
Well, and that the organizational structure, and that's what we'll go into these next couple of episodes, been passed down from one generation to the other. There's not a fundamental change. And I, as we'll talk about, I do think the military benefits from the current organizational chaos when it comes to mental health, because it allows itself to not be held accountable. No one's in charge. Again, look at the Institutes of Medicine. What do they say? There's in each quote, in each service branch, there is no overarching authority to establish and enforce policies for the entire spectrum of PTSD management. What do you mean? No overarching authority in the military? Have you ever heard of that? I mean, there's nobody in charge. There's nobody that they can pin the blame on. And that's, again, because of this diffuse, fragmented nature of how mental health care is monitored, being delivered, and so on.
And it's still being hidden. I mean, they're getting away with it. So
absolutely. Yeah, the same. Again, I do these VA disability exams, and I'm seeing people who are still on active duty, that are transitioning out. And I see the records. There's not here we are in 2024, 10 years after that Institutes of Medicine report. And I would be more than happy to swear before Congress that nothing's changed. Nothing fundamentally had changed as far as how military mental health care is, the organization, the leadership, and the policies around mental health.
Well, it seems like our book has and will continue to make a difference in terms of our having a record, and that everyone can read it for themselves. Well, I'm
That's
wondering
that's
if,
the hope, isn't it? Yeah.
what's that?
That's why we wrote this book.
Right.
That no, at least there's some document where there was none that tied all these loose ends together for somebody, hopefully, to pick up and then not to recreate the will, and then can maybe focus on implementing the solutions. Some of which that we make in our book about how to correct the problems of organization, and we'll talk a little about that as well.
Well, in what occurred to me after I, read it through thoroughly and made notes, etc., is who will be the champion for mental health within the military? Do you know of anyone?
I don't know of anyone personally. I know that in the past, because of the wars in Afghanistan and Iraq, that, or throughout the global war on terror, that you have individual generals and admirals and people below them, both on the enlisted and the officer ranks, that became believers in mental health because that's what they've experienced firsthand when they deployed, and people they knew. And they, the old sergeants started developing problems because of their deployments, and it made it real. It made it something. It was a concerted problem. They saw the attrition, they saw the epidemics in suicide, and all the problems that go with untreated, unaddressed mental health issues. And they became staunch advocates of it. But then, like what we were talking about before we came online, is then what happens to those generals, those admirals, senior enlisted leaders who now believe that the realities of the psychological costs of warfare, and even may have good ideas on how to best manage that and stigma. What happens over the years? Move on, right?
Yes.
Retire, or they leave the service. And you have this mass transition, over 100,000. I think I read somewhere about 100,000 military personnel a week or something like that leave the military. And, and then, of course, under 100,000 are in the recruiting stages and replace those that are lost. So you get this cycle of transitioning. So what happens, to those lessons learned from those people who do have the position and authority, who really care about mental health and try their best, maybe in their levels, to make changes, but then eventually they retire. They leave the military.
Very discouraging.
Well, it's the reality. So how does the military deal with that as far as the continuity of learning its lessons? Well, in military medicine, there's battlefield lessons, right? How do you treat burn victims or multiple amputees? And, how do you prevent rapid diseases, contagious disease, and all that? So on the military medicine side, on the battlefield tactics side, weapon development side of the military mission, there are dedicated lesson learned programs that are by policy. These are actual physical programs, centers of lessons learned, who have dedicated personnel and policies to capture these lessons and to incorporate that into the DNA of the military. That it becomes further training on tactics, how you deal with IEDs and counterinsurgency, all those lessons learned, or having to be relearned in some cases because those were not new to the current wars, but that those become part of the training and dogma and hard learned, hard won, earned lessons, rarely forgotten when it comes to military medicine and battlefield tactics. Right? They're taught in the academies. They're reinforced by adopting new policies or updating policies. So these dedicated lesson learned centers help prevent the military from forgetting and allow the continuity of care, even though you have this constant transitioning of people, like we talked about. People retire, people get out of the military, and so on and so forth. All with the notable exception, there is no dedicated centers for lessons learned when it comes to wartime psychiatry or mental health.
And it's not so simple to say, okay, well, let's just do that now, because who would do it? Well, in other words, they're all filled up with their assignments. There's no one around that could do that unless abilities created. Something changes.
Yeah, something changes. It's going to have to be a top-down change, either from Congress or, from the secretaries of defense or whoever is in charge of health affairs or the Surgeon General. Somebody needs to initiate these changes and incorporate that.
You've never found any evidence that there have been efforts,
Oh,
correct?
absolutely not. In fact, just the opposite. Which
Block it.
explains why in 2014, again, over 14 years into the war, that the Institutes of Medicine, and there are more quotes like that in our book, that even beyond 2014, have the same conclusions. So yeah, right now the military has no incentive to change its organizational structure. And which kind of brings me to this one thing, and I've talked about this in these documentaries that I've been a part of. Thank You for Your Service with Tom Donahue and Strangers at Home that you and I participated in with Beth Donahue. About and I get a laugh at it just because it's so obvious to me, at least. I don't know how the listeners will think, but about what is the current organizational structure, right, when it comes to medicine, military medicine. And the one way the military holds a chain of command that's accountable and responsible for implementing these policies and monitoring things and making changes and firing people if they're not doing their jobs is they've established what are called corps, right? Corps. These corps have their organizations that are led by usually a flag officer, a senior admiral or senior general. And they're responsible for recruiting, people for their positions, for training them, for monitoring policies are being implemented, for research and for retention and reporting, monitoring, tracking. All those things kind of come within these corps. And so that's how the military has, it says, there's 0.3 million employees of the DoD or whatever it is. So this is how they break up these letters are responsibility and accountability through these corps. So the different corps that exists, like the medical corps, obviously, that's headed by the Surgeon Generals. Then you have You have the legal corps, the J Corps, right? Lawyers. You have the nursing corps. You have the supply corps. Who am I going to forget?
Dentistry.
What's that?
Dentistry.
Dentistry, of course, the dental corps. Yes, you have a civil engineering corps. You have,
Mental health. Mental health corps.
yeah, that's the one thing you don't have, obviously, is a mental health vehicle. You even have a veterinary corps, all of which are needed and necessary. I don't bemoan any of that. But yeah, like you pointed out, where is behavioral health or mental health? And it's kind of lumped together. You have psychiatrists and primary care physicians, medical doctors that are in the medical corps. You have nurse practitioners, psychiatric nurse practitioners, the RNs that are in the nursing corps. You have the chaplain corps. That's another one I forgot. The chaplain corps provides different counseling services as well as their pastoral duties. Then you have social workers in the military, and you have psychologists like myself and occupational therapists. We're lumped together in what's called the Medical Service Corps. That includes, I don't know, 12 or so clinical specialties like optometry and radiology and lab technician, lab personnel, et cetera, all part of this medical service corps. We're all lumped together, along with all the administrators of the hospital. So the bookkeepers and the people who keep track of records and all these administrative, and that's another 12 or so different specialties. So you have this massive medical service corps. And so everyone's spread out. And they have different corps, have different policies, they have different pipelines for funding, different training. And so it's very fragmented in that way. So that's military medicine, how it's divided up, right? And we already established there's no behavioral and health core. Well, if I could, let me go on and explain the rest of how the organized mental health is organized throughout the military. So you have the medical side that we just talked about, the military medicine, and then you have in every base these fleet and family community counseling centers. Essentially, they're called by different names. The Navy, they're called Navy Fleet and Family Counseling Centers, and the Marine Corps is the Marine Corps Community Counseling Centers, and the Army called the Army Counseling Centers. The Air Force has their life skills or whatever, they keep changing the names, but basically what these are counselors, these are centers that employ social workers, licensed counselors, psychologists, and substance use professionals, and they belong to the line. They don't belong to military medicine. So by the line, that means the base commanders who are not medical professionals. They are, they're infantry soldiers. They are captains of the Navy, right? They are air wing captains in the Air Force, Marine colonels. So they belong, these thousands of these licensed mental health providers that belong to these community counseling centers belong outside of military medicine. They have their own database, they have their own policies, their own training, their own financial pipelines, their own systems who they report to, etc. So you follow that picture, you got one big swath, which is military medicine, and then you have the community counseling centers that fall under the line, and then you have these independent contractors. They're called military life consultants or mental health consultants, or they're like coaches. They are licensed mental health providers that are hired as independent contractors that have their own pipeline. They have their own chain of command. They don't belong to either medicine or the line commanders. And then you have, outside that, then you have TRICARE mental health providers, right, that belong to the TRICARE network. And there's no chain of command oversees them per se. They're just providers that are contracted, or they agree to see TRICARE beneficiaries. So these are the pipelines that you have that provide mental health. So when the Institutes of Medicine declares that there is no central authority overseeing the implementation of these mental health policies and tracking programs and so on, that's what they're referring to, is that fragmentation. There is no one in charge. There's no single agency in charge to integrate all these different programs and services. There's no one to ensure that policies are implemented across these different type of services, different service branches, as well as these different components. So that system is inherently fragmented. And unlike military medicine and all the other core that we rattled off, it's unique to mental health, that it's that fragmented, which kind of helps answer the question, well, why is there no accountability? Why isn't somebody being fired by mental health? Well, there's nobody in charge of mental health. There is no authority of mental health. It belongs to a lot of different people, a lot of different agencies. So you can't fire everybody. I guess you could, but that's the status quo. It has been the status quo for a long time and remains unchanged.
What a mess.
Yeah.
And it's been that way for a long time.
It has. Now, that said, in the Second World War, as the greatest generation done a lot of great things, they actually had what they called a reconditioning corps, which included neurologists. And neurologists, of course, belong in the medical corps now. But they had psychiatry, neurology, psychology, social worker, occupational therapists, art therapists, vocational counselors, to help people transition from the military to work, pastoral care, music therapists. All that was integrated into what they called the reconditioning corps. And that existed because President Franklin Roosevelt sent an executive action executive order to the military. I think it was in 1945, if I'm not mistaken, that said that the military is going to be accountable for making sure that everybody who, before they get discharged from the military, gets the full benefit rehabilitation services for psychological rehabilitation. And that's what led to them developing this reconditioning core. This is multidisciplinary, very progressive, and is well documented in that film. I think we talked about Let There Be Light. Well, when the war ended and when Roosevelt died, before the war ended, and when Truman took over in 1946, the Second World War ended, so did the reconditioning core. And so did all the other lessons learned that generation documented. And we haven't had anything similar to it since then.
Okay, I have an idea.
Yeah.
We should, our next book, I'm waiting for you to smile. Our next book should be on treatment, on recovery, on despite the lack of attention and et cetera, within the military.
Yes.
And all the lessons that we've discovered and you discovered bring forward, and there will be, it is planned, it is ready to go. What do you think?
That would be amazing. I mean, that would be in keeping with how we prepare to go to war when it comes to dealing with battlefield wounds, the physical wounds of war. And that there's these lessons learned, there's all the checklists that are required, what you need when you go to war, and having enough people and have enough materials, and having the chain of command, right? Having the leadership be properly trained and ready and equipped to meet.
We'll have a checklist.
Yeah. So here's something. Yeah, no doubt. So in 2013, I go back to the Institutes of Medicine in 2013, I also made a comment about the issue around the military organization. And so this is a year before the 2014 comment that I just read out. And this is their statement, quote, providing uniform services within the DoD and VA healthcare systems across geographic locations, facilities, and providers should be a priority. Exclamation point. Fragmentation of care diminishes continuity and coordination, often resulting in higher use of emergency departments, increased hospitalizations, duplication of tests, and increased costs. Unquote. So the 2014, verbiage that we read off, is just piggybacking on 2013. You can find them in 2010. I mean, almost every year. In fact, since 2001, since the start of the war in Afghanistan and then Iraq, and then, the more global war on terror, I went through and counted how many separate investigations into military mental health care, not the VA, military mental health care, have there been done? Commission studies, right?
214.
214. What folks need to know is that those are multi-million-dollar taxpayers spent commission studies. And when you go through those, and we cite some of those in our articles and in our book too, that they basically keep repeating the same problems in every aspect of mental health care, whether it's staffing, it's training, it's treatment, it's prevention, it's suicide awareness, it's family, it's transitioning people out of the military, everything. And out of 214, you're going to find the most redundancy in all of this that you can imagine. And then it begs the question, what the hell's going on? Whose head is rolling because people are ignoring each of these studies, 214 of which are saying basically the same thing as the DoD task force said in its 99 corrections in 2007. And of course, the answer is nobody's held accountable. No one's fired. There's no congressional hearing. Hey, we just had the 214th commission study. And by the way, that was back in 2000 and whatever, 20 up to 2020, 2021 when we wrote this book. So how many other studies have been done since then? you can bet there's been dozens of other commission studies been done. And yet there's no one to say, hey, what the hell is going on? How can we keep spending good money and saying the same thing? And what's happening? Why is things not changing fundamentally, given all the scrutiny and all these recommendations that keep occurring over and again?
Well, certainly I've noted that in 2007 DOD, the mental health task force, year-long review, war planning, etc.
Yeah.
And along with the organizational capacity to meet the basic mental health needs of 21st century fighters and their families. But yet, has anything come out of that? I mean, was that like the number 17 out of 214? I mean, where did that fall?
Yeah, it's one of those 214 studies. That year-long DoD task force was just one of 2014. And it was really pathetic, as the DoD task force makes this conclusion, which they urgently pleaded to Congress, right, in the national media, and they said this is their final conclusion. Quote, "The time for action is now. The human and financial costs of unaddressed problems will rise dramatically over time. Our nation learned this lesson at a tragic cost in the years following the Vietnam War." Well, we learned it after the First World War, the Second Korean War, before that, but yeah. Fully investing in prevention, early intervention, and effective treatment are responsibilities incumbent upon us as we endeavor to fulfill our obligation to our military service members, unquote. Well,
Yeah, what was the general's name who headed this up, that particular one? We should get him on the show, man.
well, he's the
We
one.
should invite him.
Well, he's the one who got dismissed because of the Walter Reed barracks, the Surgeon General.
I wonder why. Now, don't you think that there's some?
He didn't get fired because of the lack of mental health treatment. He got fired because physically wounded. You know, the snafu in the medical side of medicine, the physical. Now, some of those were also people who had psychiatric problems as well. So there's a little bit of a mix, but the dominant reason was the neglect and the barracks and the lack of medical follow-up, and the policies at that point were deplorable, and somebody's head deserved to be rolled, and he's the head of military Army medicine, and it was Walter Reed. So Secretary of the Army and the Surgeon General of the Army both get fired as a result, and appropriately so, but not for the DoD task force on mental health. And the head of that, became I forget the name of the individual right now. I'm blanking. That it doesn't matter.
Well, but the individual or the group, one member of the group that did speak articulately and demanded more to be done with regard to mental health services. I mean, shouldn't we invite that person?
Oh yeah, we can certainly invite. I don't know how to get a hold of any of them, but I mean, I knew some of the task force members personally, but I'd have to go back and, I mean, how do you find them? And they're spread all out. They're all out of the military by now.
I thought that we had identified them.
Oh,
maybe I'm wrong, or at least the head of it. And you had talked about it already on, I'm pretty sure, on last week's show. He was a 2-star, I think you mentioned.
Yeah, I'm kind of blanking right now. I'd have to go back and look at my notes from that time. There is a copy of the DoD task force report I have that lists all the members of that task force, and we can go over that in a next time too. If you want to try to locate them, I mean, it'd be great to hear the inside scoop.
Say what? Say that again.
It would be great to hear from somebody on that task force, if they would be willing to speak and share with us what the inside story is that, help us fill in the blanks. But how did they feel when they made these recommendations back in 2007? And then 7 years later, the Institutes of Medicine says as I read that first quote, right? There's no central authority in charge. Everything's fragmented. There's a lack of accountability. So that was 7 years after the task force released this and had this urgent pleading that we had learned these lessons in Vietnam. Oh, and by the way, the lessons learned that were documented in the Second World War, that they compiled both the First World War and the Second World War. The Surgeon General at the time of the Army, his name was Leonard Heaton. He made a conclusion in their 2-volume, I think it's about 6,000 pages of psychiatric lessons learned from the Second World War, documented, data-driven, every aspect of mental health. This was his conclusion, General Heaton. With this information so readily available, there can be little excuse for repetition of error in the future wars should they occur, unquote.
Mm-hmm. That's pretty definitive.
Yeah. And he's absolutely correct. I mean, I have both of these volumes. They're not, you can Google them. You can find the PDFs of these too from the Army Medical Department. And it's absolutely comprehensive. It touches every aspect of mental health care and what worked, what didn't, and what were the recommendations for future generations. And so it was well documented after the Second War. It wasn't just after the Vietnam War, as the 2007 task force alluded to. We've known what should be done, and we still know what needs to be done, but we have yet to do it.
Okay, well,
yeah, I know. Debbie Downer here.
No. This is good. I mean, it's just appropriate. That's reality.
It is. That's true.
Well, let's end this.
Yeah, this is a good place to end this episode, and then we can pick up and go a little more into the weeds about, that we haven't gotten enough in the weeds, but we can talk a little bit more about this whole issue of accountability at the next episode.
Yeah, sounds good. Okay, man.
All right. Until then,
later.
see y'all. Take care.
Okay.